information about dealing with cravings, looking into their thoughts and how that might affect their use. We've got some information about developing refusal skills and also problem solving and relapse prevention. The incentives that we give for people accessing this program is a $10 iTunes voucher as well as a prize draw entry for an iPad mini. So the prize draw is obviously delayed reinforcement, but the iTunes voucher is much more immediate. And we're very much focused around retention, not looking at reduced substance use or anything like that. The way we present these resources, I mentioned briefly before that we use videos, audio, we also use downloadable worksheets, and we've got a couple of characters that help to explain use of these worksheets. So we've got their completed worksheets on the site for people to see. And this is Pete and Jessie. That's the people who can take us through their own examples of using these worksheets and using these resources. Okay, so what we're measuring is we're looking at severity of dependence. We're looking at their levels of distress. We're also looking at services they've used. We give them the drug and alcohol section of the ASI, just to see where their use is at. We also look at their self-efficacy in managing high-risk situations for use with the drug taking confidence questionnaire. We're also evaluating their treatment readiness and stage of change, and also their treatment satisfaction, so their kind of feelings about that site. The other thing we did is we've looked at the literature, and there's a lot around, a lot of strong recommendations around looking at the usability of a website. That if the site's not very usable, if there's problems with it, that can actually affect initial engagement and might explain dropout or people not accessing the site, and would be, I guess, a bit of a false result that way. So we did go ahead and run